Hey everybody, today we're going to be talking about hip abduction. So hip hip hooray, and here are some of the things we're going to be talking about in this video. So without further ado, let's get started. Alright, so now we're going to be talking about some muscles of hip abduction. So you guys should have learned about this in your anatomy class. So the primary movers are the gluteus medius, minimus, and tensor fascia lata, and your secondary movers are your piriformis, sartorius, and rectus femoris. Patient is performing side-lying leg lifts with cuff weight around the distal ankle. The patient is side-lying with their legs extended, and the patient can stabilize themselves with their body weight and their arms to prevent them from rolling forward. To make the exercise easier, you can do so by moving the weight more proximal. Correct form is important. You don't want your patient having too much hip extension or too much hip flexion. You also don't want them to roll posteriorly. The correct form is trunk in neutral position, legs extended, and then raised in that same neutral position. The PT can stand behind the patient and prevent them from rolling off the table. This info is taken from the ACSM Guidelines textbook. The type of exercise that we looked at was side-lying leg lifts. The frequency of this should be performed 2 to 3 days per week. Intensity depends on the patient's 1 rep max. To build strength, start off with 3 sets of 10. For time, there is no specific duration of training that has been identified for this exercise. Research has shown that the gluteus medius is more active during hip abduction in the coronal plane. One study by Macbeth analyzed the EMG activity produced by the primary muscles of hip abduction and found that the gluteus med had the most activity. Another study by Thorberg found that hip abduction exercises can be done with or without external loading. The study indicated that the subject's strength gains were increased to the same extent, whether they had weights or whether they just used their leg during hip abduction exercises. Thus, the PT can choose whether the exercise can be performed with or without weights, depending on the patient's status. This stretch targets hip adductors in order to increase abduction. The patient is supine with legs extended against the wall. The SPT stabilizes just distal to the patella on one leg, while also slowly moving the opposite leg into abduction. For this stretch, you want to make sure that the patient is as close to the wall as possible with their legs in extension. You also want to make sure that the patient's legs remain in a neutral position, not going into any internal or external rotation. When the patient is progressing, they can perform the stretch without the SPT's assistance. The patient is supine. You want to make sure to tell the patient what to expect and what you will be doing. You're going to be holding at the malleoli, supporting the foot, and holding the medial femoral condyle. Go through the motion slowly, making sure to tell the patient to relax and let you do the work. Stop when you feel resistance or when the patient tells you to stop, and make sure that they do not go into any internal or external rotation or hip flexion. The patient is supine with hip and knee flexed. A towel is wrapped around their adductors, and a belt is wrapped around the patient's leg and the SPT's bottom. The SPT stabilizes at the knee to prevent it from moving during distraction. The SPT sits back and uses their body weight to perform the distraction. The amount that the SPT sits back depends on the patient's pain tolerance. If you see discomfort, stop. The SPT's hands are free to stabilize at the lateral aspect of the knee. The other hand is supporting posterior aspect of the distal leg. While distraction is being performed, the SPT can move the patient's hips into external or internal rotation. Alright, so in this video, we learned about passive range of motion, joint mobilization, strengthening exercises, flexibility exercises, and the muscles that act on hip abduction. I hope you guys learned something and become better clinicians in the future.